Good afternoon, ladies and gentlemen. My name is Brandy Kirkwood, and I advocate for children with mental illness. Mental illness affects 1 in 5 young children. It is estimated that about 15 million young children are and can currently be diagnosed with a mental disorder. Not only does mental illness affect young individuals at such a young age, but it is also the main reason why suicide is the second leading cause of death in children ages 10 to 24. Children's mental illness is an essential part of how they live and work. This illness affects children's ability to succeed in school, at work, and how they function in society. If a child went without treating their mental illness, they may not know how to function properly in society, thus not knowing how to function when they get of age to live and work on their own within the community. By catching mental illness early in children, we are able to help redirect their thoughts and actions. Children's brains are still forming, as are their behaviors and habits. Catching mental illness early on allows for redirection to be made to better help encourage healthier behaviors. Mental illness, predominantly in children, needs to be addressed because they are the future of this society. By helping these young individuals and showing them a different way to think and getting them the help that they need will allow for a healthier youth society, as well as showing how far medical treatment has come. Today's healthcare has the materials they need to help these children, but they need the help of the legislature to enact on their plans. Today, I am here to propose a public health policy for all of you to vote on. In the state of Iowa, at the beginning of the year, there was a list of 10 items on agenda for the Iowa legislature. The 5th item on this agenda was mental health services. I am proposing a policy for mental health services to be offered in schools for students. This policy will allow for students to have their mental health state evaluated at the level it needs to be, allowing for problems to be caught early on, as well as helping students to receive the care that they need if they are suffering from a mental illness. This policy will help to address the issues of childhood mental illness because it allows for a clinic-employed mental health provider to watch children, notice the warning signs of mental illness, and help treat them before it progresses within the child further. Children suffer from mental illness for multiple reasons, a main reason being bullied in school. When a child is bullied, they generally become depressed and withdraw themselves socially from society. When this occurs, the child often suffers not just physically, but mentally and emotionally as well. This policy would give clinic-employed mental health providers the opportunity to catch the many stages of mental illness within children and help alleviate or reverse the effects to help ensure these children live a healthier lifestyle, both physically and mentally. By helping these children at an early age, we are more likely to benefit from treatments and have a better chance of becoming functional individuals within society. When looking for mental health treatments in society, especially for a pediatric patient, there are few and far between of these services. By offering these services within our school system, we are opening new doors for both children and their families. With any policy, there are both pros and cons. There are many pros that come with enacting the policy to put mental health services within the school system. The first one, by catching mental illness early on, the same child is able to begin coping with their illness sooner. By coping with their illness, they learn to live with it as well as learn how to function day to day with it. This is important especially for when this child grows up. Number 2, by catching mental illness in children, the predominance of this illness showing up when they are adults is less likely because it was caught early on, and the child is more likely learned how to live with it. Number 3, by offering these health services in school, the child is able to confide in someone about what is going on and receive the help that they need. Number 4, also by offering mental health services in school, a child's action can be taken into consideration, and signs of mental illness and suicidal thoughts can also be caught long before it is too late. Number 5, families generally do not think about going to the doctor first when they think their child is suffering from mental illness. They are more likely to go to a school or a faith-based affiliation. If the school is already offering a mental illness health service, the family may feel better about their child in the hands that they are putting them in. And number 6, by catching mental illness within a child early on, the statistical rate for childhood mental illness and childhood suicide can decrease dramatically. With pros, there are also some cons to follow. However, in perspective, the pros seem to outweigh the cons. Here are some of the cons that may be found within this policy. Number 1, families would likely have to pay for this service through the school, either with insurance, Medicaid, self-pay, or another source. Number 2, mental health care services often have a poor reimbursement method with them. Therefore, many families do not want to have to pay for this service. Number 3, families who do not have insurance or do not qualify for Medicaid may not be able to receive these services unless they were to pay out of pocket. Number 4, not all individuals know how to notice the signs and symptoms of mental illness within children. Some families may not notice or believe that their child is suffering from mental illness and may refuse to let the school, mental health professional talk or even treat their child. By enacting the policy, the state may receive some negative feedback. Not all individuals believe that healthcare should be involved within a child's learning environment. Some individuals may also not believe that the school has a right to notice these things within their own child that they may not have noticed themselves. By enacting this policy, negative feedback may reign from the community and the parent board within the schools. However, by not enacting this policy, a chance to help thousands of children who are struggling with mental illness may be missed. Negative feedback would be had if the policy was or wasn't enacted regardless. Enacting this policy is a good idea because it will help these children learn about mental illness early, learn how they can live with it, know the signs of it, and be able to help other people who may also be struggling. By creating healthier youth, we would be helping to create a healthier tomorrow. Thank you, and have a good one.